OCD can literally take over your life. But what is OCD? In this video, I'm going to take you through the basics of OCD, from the signs and the symptoms to the types and the themes, as well as the treatments. Welcome to my channel. I am Dr. Liz White. I'm a consultant clinical psychologist and OCD and anxiety specialist. And I spend a lot of my time in therapy helping clients overcome OCD. Don't forget to hit that like and subscribe button. So what is OCD? OCD is Obsessive Compulsive Disorder, and it's a mental health condition characterized by obsessions and compulsions. In the UK, it can affect about 12 out of every 1,000 people, and globally, that figure is about 18 in every 1,000 people. But it could be much, much more than that, because OCD is generally characterized by a lot of shame, a lot of stigma, and so a lot of people don't come forward, they don't get help, and some people sometimes wait years until they reach out, if they reach out at all. Obsessions are repetitive thoughts, images, urges, impulses that cause anxiety, and the big one, doubt. They are ego dystonic, which is a fancy word for they go against your values, your morals, and who you are as a person. So the other thing to know about intrusive thoughts is that they are incredibly distressing and they are unwanted, i.e. they pop out of nowhere. Compulsions, on the other hand, are repetitive behaviours or actions that are very time consuming. Compulsions can be physical, i.e. washing your hands or checking the doors or windows when you leave the house, or they can be mental, i.e. you can be sort of mentally reviewing your memories. You can try and replace the thought that you've had with a nicer thought or a more neutral thought. Now, when people think of OCD, they usually just think about compulsions, because that can be like the only thing that you see if someone is, washing their hands excessively. But that is just the tip of the OCD iceberg. The OCD experience is often characterized by lots of shame, guilt, frustration, anger, sometimes a need for certainty and a sense of urgency and a heightened sense of responsibility as well. It takes up your time, it can ruin relationships, it can stop you going to work, stop you socializing, stop you studying. It can have a significant impact on your life. There is also research to show that up to 1/3 of people who experience OCD also experience depression or low mood. Now, if you are the loved one of someone who is experiencing OCD, then you may be finding it quite frustrating when you see your loved one doing the compulsions or getting stuck in the obsessional thinking, because you find it hard to really understand, why are they doing that? It makes no sense to me. And that's a really common experience. But in my experience working with people with OCD, that frustration and that anger that can be there is so tough. And it's tough for them because people who experience OCD know that what they're doing isn't logical. They know that they're having intrusive thoughts. They know that those thoughts are leading into, or sort of pushing them into, doing compulsions. And that's where the frustration is that they feel like they have to do it, otherwise something bad will happen, or it will mean something bad about them, or it may mean that they're not preventing some kind of harm to themselves or someone else. Someone with OCD might say, I know that washing my hands 10 times over doesn't actually make any difference to the cleanliness of my hands, but I just feel like I need to do it that amount of times. I need to do it so that it feels right, or I need to do it so that I can be certain that nothing bad is going to happen. So what are the different types of OCD? In a moment, I'm going to take you through the main types that get talked about a lot, but I'm also going to take you through the lesser known symptoms or types of OCD. And one thing to note here is that OCD can really vary. So for one person, it may just be a lot of compulsions with the intrusive thoughts. With another person, they may experience more obsessional thoughts without the overt or physical compulsions that you might be able to see. And I just want to say something about pure O, which again gets talked about a lot on the internet. It's not actually a recognized psychiatric or mental health condition. It's not in the DSM-5 or the ICD-11, and they are the psychiatric manuals that psychiatrists use to diagnose psychiatric conditions. But there is a lot of debate about whether pure O exists, because there are people that experience just the obsessional thinking. However, in my experience, when you actually talk to the person about their experience, what you find is actually they are doing compulsions. It's just that they are mental in nature. So contamination fears are fears around getting dirty or contaminated in some way and coming to some harm, or someone else coming to some harm. And this may lead into things like hand washing or excessive hand washing. Some people can also experience something called mental contamination, which is when someone feels like their mind is contaminated with bad thoughts. And that can be a particularly distressing type of OCD in my experience. So next up is symmetry and order. And this is the type of OCD that gets seen in films and things quite a lot. So the need for things to be in a line or in symmetry or have a certain order to them, or objects have to have the right place in someone's home. And that can come along with that feeling of sort of things just need to be right. And then we have doubt and harm. Now, this type of OCD is when you're very concerned about your actions and how they will impact on other people, or whether they will cause harm to someone else. And these sorts of fears can lead to excessive checking. So, for example, if you're driving your car, the thought pops up, have I hit someone? Then you go back to the place where that thought popped up. You drive back, you check, you see, is there anyone on the road? Can you see any blood on the pavement? Is there anyone around? You might check your dash cam. All these kind of things, all these behaviors, these compulsions can come out of that one obsessional thought. Next up is unacceptable or taboo thoughts. Now, this is where you experience intrusive thoughts that are felt to be unacceptable, taboo, or stigmatized in nature. And they may carry themes along the lines of things to do with religion, sexual thoughts, violent thoughts, etc. So, for example, you may have thoughts about physically harming other people or being abusive towards others. Now, these types of intrusive thoughts are incredibly distressing. They carry so much stigma and shame that people tend to not ever talk about them. And I want to make a really clear statement on this. Having those types of thoughts does not mean that you are going to go and do those things. Remember, intrusive thoughts are ego dystonic, i.e., they are the opposite to your morals and how you are as a person. But hit subscribe because I will be doing more videos on this in the coming weeks. Now, next up is perinatal OCD. So perinatal OCD is OCD that occurs during pregnancy or just after you've had a baby. Now, people who have previously experienced OCD can go on to develop perinatal OCD, or people who have never experienced OCD can experience perinatal OCD. Now, having a baby is, one of the most joyous and, arguably most stressful things that you can go through. So having intrusive, distressing, anxious thoughts about your baby is par for the course. However, in perinatal OCD, it comes along with it a lot of distress, and it really impacts your ability to function day to day. So next up, we have relationship OCD. Now, relationship OCD is interesting because it tends to be two different things. So you've got either intrusive thoughts about your partner. So that could be his or her physical attributes or qualities or personality traits. So things like his nose is too big, or she isn't funny, or he's not intelligent enough, etc. Or you can be more relationship focused. So thinking about, is this person right for me? Is the relationship what I want? Am I happy in the relationship? So lots and lots and lots of doubts about the relationship. And the kind of compulsions that can come along with relationship OCD is, you might check your partner's phone if you're worried about them cheating, or you may seek reassurance from your friends about whether they like your partner. But there's a lot more to say about relationship OCD, and if you want me to do a whole separate video on it, then let me know in the comments. So those are the types of OCD that get talked about the most, but now I'm going to just touch on the types of OCD that don't get much airtime. So first up is sexual orientation OCD, and this is where you have intrusive thoughts and doubts about your sexual orientation, regardless of your sexuality. Then there are obsessions and intrusive thoughts about life and death, so-called existential OCD. So this is where you sort of really worry and have anxious thoughts about, life, the universe, why am I here? What's this all about? How does this all work? The world and the universe, like some really big questions that can be so distressing for someone, and someone can get really stuck in thinking about these questions, these philosophical questions. And finally, we have real event or false memory obsessional thinking or intrusive thoughts, where your mind kind of goes into trying to think about what's happened in the past, trying to go over your memories because you're not sure what happened. And there is an excessive concern about what happened in the past, and specifically what your actions meant for yourself or someone else. So OCD isn't just about obsessions and compulsions. There are also other elements to OCD like avoidance and reassurance seeking. Now, avoidance shows up in lots of psychological difficulties, particularly anxiety, but for OCD, it can be quite a strong feature actually, where you avoid triggers to the obsessional thoughts. So for example, if you have a fear of contamination, you may avoid public spaces or public transport, places where you think there will be more germs or more likelihood of contamination. And then there is reassurance seeking. I spend a lot of time in therapy talking about reassurance seeking and how that in itself is a vicious cycle. So reassurance seeking happens when the intrusive thoughts, the distressing thoughts that you have in OCD cause so much doubt that the person feels that they need to get certainty. They need to know whether this thing that they're thinking is true or not. And in relation to compulsion, so somebody might ask their partner, did you see me wash my hands 3 times? Or did you see me lock the door? And essentially, reassurance seeking is a way of managing anxiety, distress, and doubt. But the more you use that as a coping strategy, the more stuck you get. Now, I actually have a free download to help you decide whether you are reassurance seeking or information gathering. So it's just a 1-page worksheet that you can download. It's totally free. I'll put the link in the description. So I've taken you through some of the signs and symptoms of OCD and all the different types. But one really important thing to say here is that this can get better. There are treatments available, very effective psychological treatments and therapies that can really help someone get a handle on the intrusive thoughts and the compulsions. And I've seen it time and time again. It does work. Now, the psychological treatments for OCD are varied, but it's generally accepted that the gold standard for OCD is CBT or Cognitive Behaviour Therapy and exposure and response prevention, or ERP for short. Now, cognitive behaviour therapy for OCD involves psychoeducation about OCD, so talking through what OCD is and the vicious cycle of OCD and how you can get trapped and caught in the obsessions and the compulsions. It's also about really identifying the avoidance strategies, the reassurance seeking strategies, and all of those things together so that you've got a really good understanding of what all the different elements are. Now, once the client and the therapist have a good, what I would call like a map of the OCD symptoms, they would then draw up a list of feared situations where if the person did not engage in the compulsions, how much anxiety would that cause? So you essentially end up with what we call an exposure hierarchy. Now, exposure and response prevention involves essentially exposing yourself to the feared situation or place or person or whatever it is, and learning how to not do the compulsion. And the idea is that the more you do this, the more your anxiety reduces over time and the less need there is for the compulsions. But as I said, I will be doing another video on exposure response prevention and treatments for OCD because that's a whole topic in itself. So I hope that's given you a really good overview of what OCD is. Do hit like and subscribe, and if you have any questions, just pop them in the comments. Don't forget, I have that free download that will help you tell the difference between reassurance seeking and information gathering. The link is in the description. I'll see you next time.